2025 legislative session briefing. As we get started, I have a couple of housekeeping notes for you. If you would like closed captioning services, it is available and it is at the bottom of your screen. There is a CC button. If you click there, we do have that live captioning available. Additionally, as you can see, we do also have ASL interpretation that will be spotlighted throughout the webinar. And also, this meeting will be recorded and posted on our ODHS website shortly after this call. During this conversation, most of our time today will be sharing key updates relating to the 2025 Oregon legislative session and also how ODHS is navigating federal changes. But we're also really looking forward to hearing your questions and being able to engage in a question and answer time near the end of this webinar. With that, I'd like to go ahead and turn it over to our director, Fairbourse Paxarest, and take it from there.
Thank you so much, Maria. Good morning, everyone. Really appreciate you all being with us. I know that your time is important and valuable. We appreciate having you join us so that we can all together get a better understanding of what was accomplished during the last session and what is ahead of us. With me today, well, before I say that, let's go to the next slide, please. And the next one. Okay, thank you. So some of you know, or just about to find out, that my time is short here in Oregon Department of Human Services. I am retiring after 35 years of service to the state. I am thrilled to have with me today our future ODHS Director, Lisa Wendt, and also our Chief Financial Officer, Rob Kodiri. I just want to say that I am thrilled by the governor's appointment. Lisa and I have been working together for the past 7 years, and what has been accomplished is really a joint accomplishment with Lisa, myself, our executive team, and most our staff that do the work of this agency, and with all of you in the community. We cannot do this work without you. And then also Rob Kodiri. Naturally, I'm biased, but I think we have the best CFO in the universe. This is a very complex agency with a very complex budget. And getting your arms around it, trying to land this budget, trying to balance everything is a monumental task. And I really appreciate having Rob in that role. Let's go to the next slide, please. This is our ODHS vision, as you see on this screen, and it is informed by our Equity North Star. Our arriving point when we talk about equity is this. It's inclusive of everyone. All who live in Oregon, regardless of race, identity, age, disability, or place, have the needed supports to achieve whole well-being for ourselves, our families, and our communities. Again, our work around equity continues, and this is the destination that we see for the agency, and as a result of what we call our Equity North Star. Next slide, please. The 2025 legislative session was a very difficult session for everyone, not only because the state has its own financial issues that we have to deal with, but because of the monumental changes at the federal government level. You'll hear about some of that, also known as HR 1, also known as the Big Beautiful Bill. Whatever you name and label it, it's a monumental change in the way that we do business. So the work of the legislature was very challenging because they had to create a budget with a lot of uncertainties. And as we move forward, we'll share with you what some of those changes are. And as we talk about this budget that was passed in the 25 session, we also talk about the uncertainties because we are doing a lot of analysis around what the impact of those changes will be. And we also are facing very limited resources as we move forward. And again, I don't envy the task of the governor, the task of the legislature, and all those folks that are working with the state budget. But what I do know is that we are resilient and we'll move through it and we'll work together to get it done. Next slide, please. I want to turn it over to Rob, our CFO, to talk about our key budget priorities and around our approach to this 25-27 session budget development.
Thank you, Boris. Good morning, everyone. Thank you for having us here and spending your time with us during this hour. I appreciate your partnership. I just want to thank Boris for all the kind words and all that he has done throughout the years for ODHS. And I've known Liesel for many years. I have a lot of confidence in Liesel and appreciate the partnership that we have with Liesel. So there is a lot ahead of us. And we need all the partnership and all the cooperation we need from the community and from the legislature and from everyone around us. I want to start this with the words of appreciation. As Boris mentioned, the last legislative session was packed with a lot of actions. And the limited resources we had, the uncertainties ahead of us, we had multiple conversations about possible uncertainties. And now we're coming to this place where we're learning more about federal impacts. We're still in this process to finalize the knowledge about those. However, throughout the session, the main focus, and I think that was universal and unilateral from all parties, that ODHS needs to focus on three key priorities that we have. Customer service is important, and one of them, technology improvements, oversight and capacity, enhancing safety for ODHS staff and clients. And of course, maintaining the core services for youth families, older adults, and people with disabilities. Next slide, please. Well, you see that we have quite a large budget, and 1/3 of our budget is in general fund. About 60% is coming from federal funds. That's why our conversations and our plan and strategy around how to approach the incremental impact that's going to happen over the next several years for the state of Oregon is very crucial, and taking steps incrementally and strategically, having long-term vision in sight. Therefore, our three priorities come handy here on the slide that was before. You can also see that Office of Development Disabilities and Aging People with Disabilities comprise more than half of ODHS's budget. We have other major areas like Oregon Eligibility Partnership, child welfare, vocational rehabilitation, self-sufficiency programs, and of course, our central and shared services. And some of you may know, shared services serve both ODHS and OHA. For efficiency purposes, we share those costs so we can maximize our support from shared services for our contracts, budget, finance, etc. And one other thing to highlight for me, I know we're going to be talking about some key investments. During this last session for LAB, we got approved for almost $138 million of general fund investments. And we'll talk about key investments, of course, later. I think Lisa will talk about them. Next slide, please. Majority, there wasn't any core change to ODHS's budget, the way it's structured. Majority of our payments to individuals and providers go outside. So it's about 93% here. And almost $2 billion annually is for SNAP and TN. Of course, we're going to see the impact there. And then almost $1.6 billion is for home care workers, personal support workers, and nursing facilities. So again, the personnel services and supplies comprise 7%, but in terms of payments to individuals and providers, that's still a core part of our structure in ODHS's budget. With that, I'm gonna pass to Liesel, and I think we're going to the next slide. Thank you.
Actually, you're going to me, Rob.
Oh, okay. Very sorry.
It's all good. I'll turn it over to Liesel here momentarily, but what I'd like to do is take just a few minutes to walk through the key investments for this biennium and several key policy changes that happened as a result of the session. I also want to put this in context because as we look at these investments, we also are realistic about what may be ahead of us when we look at some of the impact of the federal changes and some of the cuts that we're facing, not only in ODHS, not only in Oregon Department of, in Oregon Health Authority, but across the state government. Ultimately, the goal of the governor and the legislature is to land this budget in a way we can't do deficit spending as the federal government does. So we have to be very prudent on how we spend our money. So the realities of what has happened during the session can change depending on what the federal budget picture looks like and what the realities look like for Oregon. Next slide, please. So in this slide, you can actually see some highlights of some of our policy option packages, the investments that have been made during the session. As Rob just mentioned, safety and oversight have been major budget priorities for us during this last session. And a key example of that is Policy Option 101. Basically, the intent of the policy option is the intent of this investment is to increase in licensing and abuse complaints. We've seen an increase in licensing and abuse complaints across all of the community-based care settings in Oregon. And what we feel is that that is partly due to inexperienced licensees. So this investment basically allocates $1.3 million and requires a regulatory review shortly after a facility or home has been newly licensed, for example, within 3 months or within 4 months. What we expect to see from this investment is more timely inspections of newly licensed and newly purchased community-based care facilities, and we hope that this will actually impact their viability and they can stay open and they can operate successfully. Ultimately, the impact is to the people, the older adults, people with disabilities, et cetera, that we serve. Policy Option 101 also includes $1.6 million general funds for Office of Developmental Disability Services to increase their capacity for regulatory oversight of licensed community-based care homes, serving people with intellectual or developmental disabilities. Again, the intent of this investment is that there has been concerns that were identified earlier, and the sooner that we can get to the concerns that are identified, the more effective we can be in correcting that situation. So this basically is an early intervention and investment opportunity that we can help those providers that serve people with developmental disabilities actually meet the target that they have. Oregon, at the same time, has had another in the area of youth and family supports for you look at the next POP here on the screen, Policy Option Package 502. All of you know that Oregon has had one of the highest percentage of unsheltered youth experiencing homelessness. And basically, when you look at across the nation, Oregon ranks the lowest as far as performance. Shelter, housing, and crisis interventions, those investments that were made in those services were to actually expire in June of 2025. There was to be a 75% reduction in the program's budget. And what this investment does is that it actually preserves those funds and makes sure that we are able to continue those services. Then the last thing on this slide is Policy Option Package 201. And what this policy option package is focused on, this investment is investments to modernize our mainframe infrastructure. Some of you know that IT systems, particularly in the public sector, are lagging behind the private sector, sometimes by decades. This is a fairly modest investment to transition some of our provider payment systems, which are very outdated. Again, some of you know that some of the programming languages in those systems date back to when I was in college. So we have to upgrade those systems. So this is basically the beginning of that process. Next slide, please. What you see on this slide are some of the other key investments. Um, uh, One of those is Agency with Choice. It's about a $56.9 million investment that will expand options for consumers of in-home supports. There's also an investment in provider rates. We all know that providers struggle in this new environment with the inflation, especially as it relates to wages. This includes $75 million to increase Medicaid provider rates in the Office of Aging and People with Disabilities and Developmental Disability Services. It also includes targeted investments in aging and people with disabilities licensed adult foster homes to support a more equitable rate model. The other investment is in a workload model increase. And as you know, workload model is the structure that we use, is the model that we use to basically determine how much staff, how many staff do we need to have based on the level of the work and the complexity of the work. So this investment is about $6 million investment in general fund, and it is specifically focused on a few different areas, area agency and aging. That includes a $12.5 million general fund increase in response to workload growth in community developmental disabilities program, CDDPs and brokerages, as well as a $93,000 general fund increase and one new position to accommodate increasing workload in children's intensive in-home services. Next slide, please. What you see on this slide is, I think it's actually the next one. Yeah, thank you. So what you see on this slide is some major policy bills from the last session. Senate Bill 136, $480,000 in general fund investment. The aim of this investment is to strengthen the program's response in cases where repeated technical assistance would help underperforming providers remain licensed. Again, we want facilities to stay open. We want them to serve the people that are being served. And in order to actually support them, sometimes again, you need to provide technical assistance, and the sooner that we can provide that, the better the viability of that facility being able to be successful. Senate Bill 296, that's a $2.1 million general fund investment, and it addresses delays in discharging certain patients from hospitals. You know that quite often, especially with older adults, people with disabilities, when they end up in the emergency room, the lower level of care, meaning the step down, takes sometimes a long time, and that's sometimes because of eligibility requirements. This investment shorten that time frame and make sure that that eligibility determination happens in a faster time frame. We are also asked, the legislature asked us to study the current regulatory framework for facilities serving individuals with complex needs. And then we are to report back to the legislature on the resources that's required to expand those services. So that's a responsibility that we have. And then Senate Bill 739, there is $2.6 million general fund investment. and it helps shore up the regulatory oversight requirement for certain homes and facilities licensed by APD and ODDS. And it requires facilities to notify residents and the family members of certain regulatory action that may impact residents and allow for adult foster homes in good standing to hold 2-year licenses. So, two things. One is we want to make sure that facilities are transparent and let those people, the residents and their family members, know what is happening within the facilities. And then the second piece of this is if a facility is actually operating at a high level, we can extend that licensing oversight and renewal to 2 years rather than needing to do annual license renewal. And then Senate Bill 960. This is in support of House Bill 5006. It's a $2 million investment that ensures that refugees resettlement agencies can contract with Oregon Department of Human Services. So that's, again, very high level and quick overview of what has happened during this last legislative session. I now turn it over to our incoming ODHS director to talk about how we plan to navigate the federal changes as a result of the bill that's also known as HR 1. And again, thank you all for being with us. Grateful for you all. And I will sign off and hand it over to Lisa until questions and answers.
Thanks, Fair Wars. Good morning, everyone. I'm Lisa Wendt. I'm currently Deputy Director at ODHS. And like Rob, I want to thank Fair Wars for his patience, his mentorship, and as all of you have experienced, just his unrelenting focus on improving things for people in Oregon. We've all learned from that and we'll carry that legacy forward. I'm going to spend a few minutes talking about both process and content updates as it relates to primarily HR 1, as Fair Wars mentioned. This will be quick. This won't be the last time we talk about federal changes, but we wanted to really highlight some of the big impacts to ODHS. So next slide, please. First, just from process, so that you all know, we've created an internal team called the Federal Action Coordination Team, or FACT. We built this just honestly based on our experience during COVID. We had created at the time we called the COVID Response and Recovery Unit, or CREW, with OHA, and just found that pulling together our teams to coordinate budget, policy, implementation, responses really helped serve us well during COVID, and kind of taking a page out of that book for our FACT work. So we're constantly assessing federal changes. We're working with the governor's office, with our Department of Justice colleagues to analyze and review executive orders, budget changes, et cetera. And then providing analysis both for decision makers and for all of you. We'll have a QR code later on that will let you know where you can find the latest updates and an opportunity for you to ask questions. Next slide. So most of you are probably following this, but HR 1 was signed into law on July 4th. The budget includes significant changes to programs like SNAP food benefits and Medicaid, also known as the Oregon Health Plan. As you all know intimately, these are programs that people count on to stay healthy, food for their families, and the various changes will make it harder for people to get the support they need and shift some of the cost responsibility from the federal government to the state. As you see in the yellow slide there, the state budget's probably not big enough to fill all of those gaps. And so, again, working closely with the governor and the legislature to talk about impacts so that people can make decisions on future investments. We're still learning more, as you might imagine. So we'll kind of share today what we know today, and then, like I mentioned, where you can find information as we continue our analysis. Next slide. As Rob mentioned, our entire budget is about 60% federal funding. The two primary sources are Medicaid and SNAP. Happy to share what some of the other federal sources are at future briefings. these two kind of combine to make up more than $12 billion of ODHS's budget. So again, spending some time looking at what those funding and eligibility changes will mean for us and for the people that we serve. Next slide. 1 in 3 Oregonians are covered by OHP. Again, that's Oregon's Medicaid program, and that includes roughly half of the children in Oregon. The preliminary estimates on Medicaid show the state could lose up to $10 billion in Medicaid funding over the next 10 years. Implementing both changes for Medicaid and SNAP, as I mentioned, is going to require substantial implementation efforts from ODHS and from OHA. Will have significant impacts to the one eligibility system, both revising eligibility processes and just making sure that we're in tight coordination across agencies that support the impacted people in Oregon. Next slide, please. 1 in 6 Oregonians count on SNAP to help meet their food needs. Just a couple numbers I want to highlight here. The new SNAP requirements that I'll talk about in the next slide will impact roughly 310,000 adults in Oregon, including people over 60 and those living in job-scarce communities. And that's important because of the change in work requirements. About 17,000 Oregon households will see reduced benefits due to some technical changes in what's called the standard utility allowance, and that's impacting those who have received energy assistance in the past. Roughly 17, well, as I mentioned, 17,000 people will be impacted. It means fewer households will qualify for SNAP benefits. Only households with an elderly or disabled family member will qualify once HR 1 is implemented. Next slide. So as I mentioned, work requirements, there are changes in the age ranges of those that will be impacted by work requirements. There were also, I've already mentioned the standard utility allowance or what's been called the heat and eat benefits. And then significantly too, that HR 1 removes previously eligible groups from SNAP eligibility, and so it'll have significant impacts to non-citizen SNAP eligibility. Next slide, please. A couple others I mentioned earlier, there's some cost shifts to the states. The first, we're going to be talking, not today, but in the future, about error rates. So this first one, the state has some requirements based on error rates, which are fairly complicated. That's why we will not talk about it today. But there's a cost share there. So for Oregon, that's roughly 15% of SNAP benefits based on current error rates. HR 1 also calls for the elimination of what's called SNAP Ed, and in Oregon, that's paid for nutrition education. And then for the administrative cost sharing, historically, SNAP has paid for 50% of administrative, which is primarily staff doing eligibility work. And then historically, the federal government's paid 100% of the food benefit. So in this cost share, it's going to increase from 50% to 75% for the administrative costs associated with SNAP. Next slide. As I mentioned, we're going to navigate this together. I started my career in the late 90s. Some of you may recall, and it was during welfare reform. And that was some scary times and significant changes in that era. And we will be facing some similar changes and challenges today. And our commitment is to continue to work with you, to hear your questions. We won't always get answers to questions immediately. One of the challenges we're currently facing is just with the loss of federal staff and some of the agencies, the responsiveness is not quite what it has been. So we're all kind of navigating this together. So we ask for your grace and patience. Still send us your questions and we will do our best to chase down answers to those. We are in constant communication with our governor and with our legislative partners, and we'll continue to do that as we all make sense of what the impacts to Oregon are. And, like Fairbourse said at the beginning, no matter what is ahead, we are all advocates within ODHS, and our mission remains really unchanged to make sure that we're serving people as best we can. And like I said, rely on our partnership with you all to navigate what's next. So with that, I will turn it back to Maria.
Thank you so much, Liesl. So this is a good time if you have not yet had a chance to submit your questions. At the bottom of your screen, there is a Q&A feature, and we will answer as many as we can online. I would also note that a few of them have been very specific, and we want to be sure that we are getting the most accurate information possible. So if your question is more specific than what we can answer with the panelists we have today, we will be sure to follow up with you after the webinar. And on that note, if you submit a question anonymously, we are not able to see your email to get you that follow up. So if you're comfortable submitting your questions without being anonymous, it will allow us to follow up in a timely manner to ensure your questions are answered. So with that, looking through our questions here, um, looks like our first question, when do we get to see funding for 24-hour residential settings? I believe, Rob, that one's coming to you.
So just to make sure to understand, I think any LAB investments that were approved in the legislative budget, I think the contracts are being negotiated and executed. So those should be going soon.
Great. Thank you so much. And it looks like our next question, will work requirements affect those in IDD? Not sure if we have the ability to answer that one live. I'm looking at Fairbors or Liesl possibly.
I would say that there are a lot of details that we yet don't know about these provisions that have been put in place. We are, part of the challenge that we have is we actually used to have a Region 10 um, SNAP, um, uh, basically Food and Nutrition Services office that we used to send all of the questions to. A lot of those offices, including the Region 10 office, have been dismantled. So getting questions to the federal government, getting answers back is not as streamlined and as easy as it used to be. We have some of the same questions, and as soon as we get those answers, we'll share those with you. But there's still a lot of ambiguity around a lot of these provisions that have been put in place. So we are working alongside of you to figure out exactly some of those details.
Great. Thank you, Fairbors. Our next question is going to Liesl. Is there a plan to reduce Oregon's error rate of 14% so that we can have a smaller matching obligation? And I believe this is referring to the SNAP program.
Thanks, Maria. It's a great question. The short answer is yes. We have another all hands on deck team working on strategies to reduce the error rate. So that will be a significant focus for our Oregon eligibility partnership and self-sufficiency teams over the next several months and probably years.
Great. Thank you so much. Next question. Are the number of hours for work requirements for SNAP and Medicaid benefits the same?
I don't believe so. Those are two different requirements for SNAP and for Medicaid.
Great. Thank you, Fairbors. Looking through the next question, there is someone who submitted a question mentioning that they're really concerned about how cuts might impact the number of children entering foster care. How are the funding cuts impacting support services designed to help families stabilize so that children can remain in their homes? Are there any predictions on the impact to the foster care system?
As it relates to HR 1 currently, we are not seeing. So if you're talking specifically around foster care services, we are not seeing a direct impact to those services, but there are indirect impact to those services, meaning if you're a family that are receiving SNAP benefits, or you're receiving TANF, and at the same time you have your child is in foster care, your ability to, family preservation is something that we all want to happen. We want children to be with their families. I would say that some of these requirements around the SNAP, around Medicaid, work requirements, eligibility requirements will certainly impact those families that have children in foster care. What is the impact? That is to be seen. And then at the same time, I would say that there are various time frames for the implementation of these requirements. Some of those are after the midterm election, so past 2026, 2027. Some of the provisions on Medicaid go into effect even as late as 2029. So again, there are analysis being done right now by a number of different organizations to basically lay all of this out and figure out the cross impact, cross program impact of these cuts to the population. It's a very challenging task to do all that, but we are engaged in that as well.
Thank you so much, Fairbors. And I just want to again mention we're seeing lots of very, very specific policy questions in the chat that are more specific than what we can answer on the call today. So we will again be following up. If we're not reading your question live, it's not because you won't get an answer. It's just because we want to ensure that we are checking with our policy subject matter experts to get you the most accurate information possible. I think one more question that we could answer, the question is, do I understand correctly that volunteer work is an option for the work requirement?
Maria, can I add something?
Yes, please.
So, in regards to some of those, I really appreciate those specific questions. I want to make sure people are also aware that we're also expecting ODHS. Our SMEs, of course, are working hard trying to connect with our federal partners. And I should mention something that it's been difficult to connect with some of those. There are certain how to say this. There's certain experts, our federal experts, that apparently have left, but there's still people there, and we're trying to connect with the right people. That's been a challenge, but it's working. And also, we're still expecting federal guidance, as we usually get. So to clarify some of those requirements and to clarify the waivers and exceptions with those, just the broad context that I'd like people to be aware of. I appreciate that.
Thanks, Rob. All right. Looking through additional questions here, we are trying to sort these as quickly as they are coming in. It looks like one last question I see. I understand there are a lot of these changes have not taken place yet. When can we see these changes come to be?
Again, as I noted, most of these changes have not taken place yet. There are certain changes, for example, as it relates to benefits, SNAP benefits, healthcare benefits, etc., nationwide for immigrants and refugees, which have been stopped immediately. But most of the SNAP work requirements for both Medicaid and SNAP, cash assistance, etc., all of those things will go into effect sometime down the road. Some of them begin in January of 2026. A lot of them are after the midterm of 2026, meaning they will go into effect most likely in the beginning of 2027 or the very end of 2026. What we can do, again, we are working on this, and we will have a document that basically outlines the time frame for each one of these changes as to which month would they go into effect, so that, and some of that is already available on the website as well for some organizations. Again, multiple organizations are doing this work, and we will have that on our website as well.
Thank you so much, Fair Boars. All right, we are going to transition to wrap up this call and talk about where you can find additional information and how to stay in touch. As has been mentioned multiple times during this call, we do have a tremendous amount of resources available on our website. And I believe Sunny is going to put some links in the chat. This PowerPoint will be sent out to everybody who registered and attended the webinar today, so you'll be able to access these links there. Also, as we mentioned, this webinar has been recorded, so you can go back and reference information. Here you can see that we do have a specific page on our website where you can view the ODHS budget, and that link will be available. Additionally, there is an end of session report for the 2025 legislative investments relating to ODHS, where you can dive into much more specific details. And also there are these QR codes and a link available to our Federal Changes Updates website, where you can get the latest news and information relating to federal changes and what the impact will be at ODHS. That website is updated regularly and time-stamped each time it's updated. So I believe just in the last 3 days, there have been new policy memos and updates posted to that website. Andrew, go ahead and go to the next slide. A few additional ways you can stay in touch. As a reminder, if there are ever updates or changes to any of our programs, we will be communicating those changes through all of our normal channels of communication. That would include direct communication with clients, that would be our community partner newsletter, and all of our social media channels. So if you are not yet subscribed to our partner newsletter, there will be a link in the chat and also in this slide deck for you to be able to subscribe there. Also, we do have an email address for anyone who would like to send us questions for additional follow-up. That is the communitypartners@odhsoha.oregon.gov email address. And additionally, we do have another Forward Together Oregon webinar scheduled for September 23rd that will cover all of the latest federal updates for partners. That is co-hosted between us at ODHS and also OHA. So you will be getting updates for both agencies in that webinar. And actually a date correction there, it's September 30th, not September 23rd. So a quick note there that that webinar will be happening on September 30th. And with that, we again want to thank you so much for joining us. What's next? Thank you for catching that slide. Andrew, Fairboars or Roberto or Liesl, would one of you want to cover the what's next timeline before we wrap up?
Sure, I can, Maria. Just a couple dates to keep in mind in addition to the ones that Maria shared. I think most of you know there's a special session on August 29th, primarily to talk about transportation. And then that will be followed by a series of legislative days. So end of September through October 1st, and then November 17th through the 19th. And then early January, January 13th through the 15th. The regular short session begins in February of 2026, and while it is hard for all of us to believe, agency budget development for the next biennium begins kind of January to March ish in the new year. So lots still coming, and I think as we've all mentioned, due to the uncertainty, we intend to be in frequent communication with you between now and short session, as some of these federal conversations will probably take place there. Just wanted to make sure you kind of have the what's coming ahead on your radar. Thanks, Maria.
Fantastic. Thanks, Liesl. All right, again, thank you so much for your time today. We hope that you found this helpful, and please do send us an email with any questions that you think of after this webinar. And for those of you who submitted more specific questions than we were able to answer on this call, we will be following up as soon as we can. Please note that it will take a little bit of time just because we do want to connect again with our specific policy subject matter experts to get you accurate information. We hope you have a fantastic Tuesday, and we look forward to seeing you on September 30th for our next Forward Together Oregon call. Have a great day, everybody.